So a common question we get here at Good Therapy SF with clients who have OCD is how do I let go, or in some cases try to get rid of my OCD obsessions? And just as a reminder, obsessive compulsive disorder is what I mean when I say OCD. And it's a diagnosis that we have in the DSM where people unfortunately can engage in repetitive or unwanted or disturbing images or phrases or urges in their mind. And then, as a way of trying to relieve the internal distress that comes with these unwanted, intrusive thoughts or images or urges, which are called obsessions, the way to get rid of those obsessions in the moment is to try to engage in some type of repetitive behavior that does work in the moment a little bit. It takes the anxiety down, but then very briefly, the unhelpful or disturbing obsessions return. And that kind of creates a feedback loop where people feel these obsessions occur, they engage in the behavior to try to reduce the anxiety associated with them, and it only works for a little bit, and then they're back in that feedback loop back and forth. Really, what we're trying to do here is try to help people learn how to control or suppress these unwanted obsessions to essentially reduce their anxiety or internal distress overall, and also so they don't have to engage in the unhelpful compulsive behaviors. And we really want to change that negative feedback loop that happens over time. One technique that can be helpful for letting go of OCD obsessions is to try to postpone the obsession. For example, we might ask clients to schedule time to focus on the obsession at a later date instead of reacting to the obsession immediately. And that in turn helps to break the compulsive reaction pattern over and over again. So trying to postpone the obsession as best you can is one technique. Another technique is to try to change the way in which you actually obsess. So what do we mean by that? We try to observe the thought without judgment, for example. So trying to just notice it without judgment or criticism. Or we can try to label the obsession as irrational. Or you can even try to apply a technique such as like writing it down, or even imagining that obsessional thought in a funny or cartoon type voice, just to try to externalize it and try to experience the obsession in a new or different way. And the overall goal here when we do this is just to try to create some distance between you and the obsession so it doesn't feel as reinforced and the feedback loop starts to change over time. And then a final kind of technique for trying to help let go of OCD obsessions is to use supportive statements immediately after the obsession. For example, you try to replace the obsessive thought with a more realistic and perhaps emotionally neutral statement, such as, "This thought isn't helpful right now." Or I've also heard, "It's no use trying to rationalize with an irrational thought." These types of supportive statements, again, help to interact with the negative feedback loop that can occur with OCD in a more helpful way. And that's really the goal here. The change in that feedback loop is part of the solution for success when it comes to letting go of OCD obsessions. In addition to those three techniques, we can still try to use mindfulness or meditation approach. For example, a mindfulness or meditation approach would be just simply learning to observe and label the thought without really trying to engage with it beyond that. So you're just really using the observe and label technique when it comes to the obsessional thought. Another strategy is to use cognitive behavioral therapy. In particular, within CBT, we can use techniques to try to reframe and challenge the irrational thought that continue to feed into these obsessions. And then finally, a really useful and highly effective approach is to use what's called exposure and response prevention, which is part of cognitive behavioral therapy. And essentially, exposure and response prevention, or ERP for short, it's essentially gradual exposure to the source of the obsession without performing the compulsive behavior. And we try to allow the anxiety to come up, and then it's going to gradually subside over time. So you're really learning how to, like it says, gradually expose yourself to the source of the obsession. and then have some sort of delay or response prevention to the urge or the internal distress that occurs when this happens. So the more you're able to learn how to delay that anxiety response, the better you get over time at reducing your overall OCD symptoms. So if there's anything we spoke about here today that you have more questions about or you think might apply to you, please feel free to reach out to us here at Good Therapy SF. Take care.